All right, welcome. Welcome, everyone. I'm Venton Forbes, Development Director at InterCommunity Healthcare and a member of United Way of Central and Northeastern Connecticut's Board of Directors. Before we get our event started, I invite you to join me in a moment of silence as we stand united in support of the people of Ukraine as they fight to defend their freedom. Thank you. I want to thank you for joining us for our panel discussion on health, racial inequalities this afternoon. We are thrilled you are interested in today's topic. We're excited to welcome members of both our Constitution and Tocqueville societies in attendance today. We also welcome members of United Way's Emerging Leaders Societies, also known as ELS. Thank you for joining us. To those leaders in corporate philanthropy, foundations, and DEI who are present this afternoon, thank you for being here. Town halls like this afternoon's event are intended to share information and hear your thoughts on issues affecting the well-being of families, individuals, and children in our neighborhoods and community. How United Way is in partnership with community, government, and business leaders and philanthropists like you is responding to such issues, and how, when we unite together, we can create a community in which everyone has equal opportunity to succeed and thrive. Please be advised that today's event is being recorded. Before we turn our focus on to our topic for today's discussion, I want to take the opportunity to introduce to you United Way of Central and Northeastern Connecticut's new president and CEO, who is in attendance today, Eric Harrison. Eric officially assumed his role at United Way on February 22nd. Therefore, you are among the first in our community to be introduced to Eric. Eric brings a robust career in the United Way network and the nonprofit sector to our United Way. Most recently, serving as president and CEO of United Way of Ventura County. Eric, would you like to say a few words to our guests?
Yes, thank you, Ven. I really appreciate it, and I'm just thankful to be here and really looking forward to the conversation today. I do actually have a save the date for everyone. On March 10th, we'll be having a virtual meet and greet with myself for our Constitution and Tocqueville Society members. If you are not a member of the Constitution Society or Tocqueville Society, please get in contact with Kim at the end of today's call. Her email will be shown. And then we also have another opportunity that's coming up on April 19th. There will be a reception just prior to our Red, White, and Chocolate event. So I look forward to meeting you all in person in the future or virtually on March 10th. So thank you, and look forward to today's conversation.
Thank you, Eric, and I look forward to working with you. United Way's mission is a community. Our vision is a community where opportunities are available for every child to succeed in school and for every family to achieve financial security. Historic patterns of structural racism and implicit biases based on race, ethnicity, and other identities are significant barriers to achieving United Way's vision. COVID-19 has made the effort of systemic racism and ethnic inequality even more apparent as people of color, women, and low-wage workers have been disproportionately affected. Advancing inequity outcomes for children and families have always been a core to the value of United Way. We are built on the belief that diversity, equity, and inclusion make us stronger. Although the organizations has often implicitly addressed disparities, primarily by focusing resources on historical marginalized population, achieving more equitable outcomes for communities of color was not explicitly stated a goal. However, moving forward, United Way will more explicitly and intentionally focus on addressing policies, practices, belief system, and attitudes that have prevented opportunities for many in our community. Last year, United Way released a statement of emphasizing its renewed commitment to racial equality. You can find the full statement on United Way website. As part of that commitment, United Way introduced specific criteria for investment focused on advancing equality in education, family financial security, health, and basic needs. Additionally, in the fall of 2021, United Way launched the United for Racial Equity initiative, focused on being more intentional about how to leverage resources to address inequality in Central and Northeastern Connecticut, and focus specifically on building the capacity of community organizations to equitably serve community residents and addressing the root causes of systemic racism through investments in community partners, explicitly addressing racial inequality, policy changes, advocacy efforts, community organization, and collaboration. This January, United Way awarded $1.13 million to local community organizations that were addressing racial equality in the areas of education, financial security, and health, while also serving ALICE households in Central and Northeastern Connecticut. For those of you who are not familiar with ALICE, ALICE is an acronym for Asset Limited Income Constraint Employed. These are households that, despite having a member employed, still struggle to make ends meet because the cost of living is outpacing wages. Of the $1.13 million awarded, $435,000 was allocated to United for Racial Equality initiative. These awards provide support to local community organizations to address the root causes of systemic racism through enhanced organization practices around racial equality, community organizing, advocacy, and leadership training. These awards were made possible through your generous gifts to United Way. Thank you so much. Now let's begin our panel discussion. During this afternoon's town hall, you will hear about health racial inequalities in our community that, although not new, were illuminated by the COVID-19 pandemic. You will also hear about new approaches and partnership to help Black and Brown community people connect with ways to stay healthy, and you will explore what has been learned about systems that perpetuate inequality. We would like this town hall to be interactive. So if you have questions or wish to make a comment during today's event, you can use the chat box or simply raise your hand on the screen. We'll also have a few minutes for Q&A later in the town hall. Our plan is to conclude this afternoon's event on time at 1 p.m. To kick off our event, I would like to introduce our moderator, Gina Federico. Gina is the United Way of Central and Northeastern Connecticut's Director of Health Initiatives. Gina.
Thanks, Venton. I appreciate that. Welcome, everybody. I'm really excited to be able to talk to you today a little bit about the health work here at the United Way, and even more excited to introduce you to our panel and talk with them about some of the really amazing work that we've done over the life course of this pandemic. So I think what I'd like to do is introduce our panelists, and then I will set a little bit of context around the health work and heading into the pandemic, and then we'll head into the questions. First, I want to recognize our amazing panelists that are with us today, and I'm just going to read off my screen here to make sure I get this right. But we are so happy to have from East Hartford, Laurence Burnside, who is the Director of Health and Social Services for the town of East Hartford. Carlos Brown is the Regional Vice President of Community Health and Wellbeing and Chief Diversity Inclusion Officer at Trinity Health of New England. Rashad Collins is Executive Vice President, Chief Operating Officer at Charter Oak Health Center here in Hartford. And so the reason why I'm really excited to talk to you today is because in partnership with the folks I just introduced, we were really able to do what I think is some important and really, in some ways transformative work to support COVID outreach efforts in our community here in Hartford and in Central and Northeastern Connecticut. And so to set the context for this, in 2017, a group of mostly health-focused organizations came together and created something called the North Hartford AAAM Collaborative. And that's a really, really long title. But what it is there are a couple of things happening in Hartford, including a promise zone, and Trinity Health had a nationwide TCI grant. And we decided, rather than have a number of different tables, there are about 4 designations in total, that we'd all come together and work across this kind of portfolio of health improvement initiatives. And so, that I think in itself was really exciting. And we knew that one of the things that we wanted to do around this was really center community voice as number one, and number two, really think about the work in terms of health improvement as far upstream as possible, right? So really less about clinical care and really more about improving the conditions around us, right? The social determinants of health, sometimes people call it, but really like the everything else, so that everybody can live a healthier life. And so in 2018, we took that work here to the United Way. And that was really important because that really gave us an opportunity to think about the way that United Way, can work in ways that they do best to mobilize resources and bring volunteer efforts and connect to individuals, but also to organizations to get this work done. And as we came into the United Way and we were getting settled and doing some great health improvement work through TCI and things like smoking and bringing a grocery store to the north end of Hartford, the pandemic hit. And so as many of us probably remember, when the pandemic hit, it really was certainly, I think, in the health community, kind of an all hands on deck. And so one of the important ways we started to work together, and I'm looking at Rashad right now, was really to think about, how do we, and also Carlos, how do we get information into the hands of folks in community, particularly Black and Brown folks, or folks maybe that, don't speak English as a first language, to really talk about what COVID is and what we should be doing. And it's actually kind of interesting to look at those materials now, because they're kind of antiquated when we think a little bit about, the progression of the pandemic. And coming together in that way, I think, was really helpful because it really made us need to think out of the blocks about what we were going to do. And as the pandemic progressed, we really wanted to think more about how we help Black and Brown folks in community, because as Venton spoke about, I think, we had health as a major problem, but, confronted with the fact that communities of color were being adversely impacted by the pandemic. And so we were excited to be able to continue to work with our partners and think about this work in a more meaningful way and bring resources into COVID education and outreach and vaccination. And so really, I think we want to kind of think about that today and the ways we work together. And then also, I think about the ways that we kind of started some of that work in North Hartford, expanding to Hartford, and now bringing on Laurence and even others as we look past or look east into Eastern Connecticut to this work. So I'll kind of stop there and bring out the questions, unless anybody has any questions about what I just mentioned. And let me just see here, hold on one second. And so, okay.
So Gina, one of the things I think we have to consider is that trust was the first barrier. I think the first step was to ensure that the institutions that reached out into the community were institutions that were trusted, and making sure that not only were the institutions trusted, but the individuals that were, sent out from those institutions were trusted. So we did a very big set of work And you, Mary Stewart, and a number of our colleagues worked together to identify individuals who could go into the community, who look like the community, and could really start the process of connecting with people around what it took to combat the pandemic and what the resources were to help combat the pandemic. And it started with testing. And then when the vaccine was available, it started with vaccinating. But again, it was all.
Absolutely, Carlos. I think that's a really excellent point. And I'm also thinking too about kind of, the trust we had to create not only in community and with folks, but also even, and this is a great example, but working across health departments and hospitals and federally qualified health centers, right? Because I think obviously all kind of living in the ecosystem of health, but often working on different projects on a day-to-day basis. And so I think one of the major ahas for us at this work was absolutely, really intentionally centering building trust, both with community, but also among partners, to be able to kind of work for the common good of improving the lives of those folks in the community. So I think, no more important way to kind of couch this work. Absolutely. And speaking of that, I think, this first question is really related to that. So I'd love to open it up. And, the first question is, what are some of the innovative strategies and new things that happened? What did that look like to you, our panelists? And so I can tell somebody to start, or I don't know. I'm looking, Laurence is smiling. I'll pick him. So Laurence, do you want to start? And then I can volunteer someone else.
Sure, happy to go ahead and jump in on this one. When it came to innovative strategies and what we were looking at, to add on to that point that you just mentioned earlier, you're right. Early on, we saw as vaccine availability kind of reached that point of all ages were eligible during last spring. We saw a disparity there where we had a higher proportion of our white residents compared to communities of color that had really decided to be vaccinated. And we recognized as a local health jurisdiction that we had not only maybe the challenge of an element of trust with our residents because we were not normal vaccine providers for our residents, but also just recognizing that we were a resource in general for them. So one of the strategies that we implemented was, one opportunity was to partner with United Way to have development of educational resources that were featuring local East Hartford residents that were delivering that message of, I got vaccinated to protect myself, protect my loved ones, and protect those members of my community. And I encourage you to protect others around you as well. So United Way, and in partnership with Latino Way, helped us with identifying local residents that wanted to be featured in our media campaign, developed the materials, and then got that information out there through social media, through web reach, also through printed resources to make sure that people were not just looking at officials saying you should be vaccinated, but they were looking at employees of their local grocery store, members of their faith-based community, and advising them that I got vaccinated and I want to be an example for the rest of our community. Another part of that we did was we worked with our East Hartford Connects team to identify local high school age students that also represented the makeup of our town, and worked with us to canvass the neighborhoods to get the information out there. So printed materials, we went out in neighborhoods, especially highlighting upcoming vaccine clinics that we had as mobile pop-up sites in faith-based organizations where churches were willing to sponsor them, at our library, at local schools, housing authority community rooms. We would target those neighborhoods and conduct outreach and canvassing where we would have the students teaming up with employees and members of the Latino Way, and we would have them engage with our residents to talk about the importance of vaccination and what resources were available to them, such as when we had upcoming clinics. We felt that was critical for us to really utilize partnerships like United Way and Latino Way to bring an element of recognition and trust factor there to help us with recruiting trusted messengers within our communities to bring that word and that specific advisement of the importance of vaccination early on in the process when all ages were eligible.
That's great. Thanks, Laurence. I loved kind of the well-known hometown ad campaign. I just remember a lot of people, talking about, recognizing those people in community, and it was really beautiful work. I, would love for people. I think we have some of that up on our website if you want to take a look. It was a beautiful campaign. That's great. And so going next, Rashad, do you want to kind of chime in?
Yeah, sure. Good afternoon. Good afternoon, everyone. So I think, certainly for us, being situated as the primary care provider for many residents and anyone seeking care, the pandemic challenge was unique in that it truly kept people from, coming into our space for services. So for us, it was extremely intentional for us to go out into the community and meet people where they are and make the resources most convenient for them. So one of the ways in which we had to do that was first by looking at our internal process and our systems for care delivery to be able to mobilize them and take them out into the community. We were the first health center to have the rapid COVID testing machine on site so that we could perfect that process. And then from there, we began in partnership with Trinity Health of New England to put together a mobile operational COVID testing setup that we could tailor it to the unique spaces of where we were aiming to provide the testing. So we've provided that for anywhere from shopping plazas to faith-based organizations to schools, other community-based organizations, and truly targeted areas in the community with highest need and with highest need, and also that truly had less access. So for us, it was working with community partners across the landscape to determine which types of locations would be best suited for this. And then also, besides just coming on site, it was also how we communicate that out into the community. A lot of grassroots efforts with that, and pounding the pavement, boots on the ground, walking in neighborhoods and ensuring that everyone knew that we were going to be on site. And we saw a fantastic return on that from the turnout that we can continue to get week in and week out as far and wide as we went throughout the pandemic. So from a structural perspective, that was important for us. But then in addition, as it moved into the vaccines, taking that same model and then adding the vaccine on top of that to ensure that we were able to vaccinate individuals in a very safe and consistent manner, but again, with the true spirit of bringing those services out to them. I would be remiss if I didn't mention, though, as the vaccine became available, as Laurence had mentioned as well, it's important for us to look at the rollout itself, though. So one of the things that Carlos mentioned was that trust being paramount. One of the barriers to that was that the vaccine was not widely accessible when it first rolled out. So of course, we were going to see a disproportionate number of Black and Brown people vaccinated when by and large, they were not eligible unless they met the criteria in that, phase 1, phase 2. So it was certainly interesting to see the charges that came out shortly thereafter to say, we're not vaccinating enough people, Black and Brown people in the community. And I think, certainly as we look at what we can do differently moving forward, when we talk about systematic approaches to addressing systemic racism and truly thinking of it as a system-based approach, when we think about how we're going to roll out, initiatives on a small scale or wide scale, are we being inclusive at the onset, whether consciously or subconsciously?
Yeah, Rashad, I love that. And I'm particularly thinking about that around, kind of, as you said, I think the one thing that Charter Oak was exemplary at was really listening to the pain points of what needed to happen based on the pandemic and showing up. And I, can imagine everybody on this call can understand that, like, a federally qualified health center that's main book of business is bringing people to their site was now getting into, like, for all extensive purposes, like the outdoor event business. And so it was absolutely, I think something that was a heavy lift. And I think the ability for Charter Oak to be flexible, to partner with Trinity, I think was amazing. But then, as you're saying, Rashad, like, that's a systems change in itself. And now if we can think about the other things that we really have to focus on in terms of how we're orienting the work to get, to Black and Brown folks and making sure that we're being equitable. I think that's, really the learning that we need to pull forward. That's awesome. And then Carlos? Did we lose Carlos? No, I see. Carlos, are you ready? I see he's not on mute, but I think maybe we'll move to the next question. And if he jumps in, that's great. So I think the second question that we really wanted to talk about was the range of partners, and I would call, strange bedfellows. And so, one of the, I think as the pandemic moved on, and from where kind of Rashad was talking about, where we really were trying to ensure access to all folks to get appointments, it very quickly moved, and we used to say kind of every 2 weeks the world was changing, but it very quickly moved to really figuring out how to get as many people vaccinated as possible and making people really feel comfortable and feel like the vaccine was for them to get vaccinated. And I think, the strategies that we worked at, really thinking about equitable outreach was, maybe potentially not going through just traditional clinical pathways, but looking beyond to all the different folks in the community that, people were used to interacting with day to day, right? Often people call them trusted messengers, or, the people that they interact with and organizations they interact with every day. And so the next question I'd love for the panel to discuss is really about that. And so, I think it's to my panelists, why was it important to come together in a new way around COVID response? And then, particular to your work, what did that look like? I'll see. Carlos, can you hear me?
I can hear you. Can you hear me now?
I can hear you now, sir. Would you like to comment first? You can pick either question or both.
Oh my goodness. I have like 15 different devices and none of them are working.
Yeah,
But
well, I hear you. Go ahead, sir.
let me go backwards and say, one of the things that was really important is when we partnered with Charter Oak, the key was being wherever the people needed us to be and following their leadership in terms of being in the community. So we were critically thinking about how to be present without letting our own, impressions guide us, but letting the community instead guide us. And partnering with Charter Oak and partnering with our other community leaders was essential in doing that, because that's where the rubber meets the road. when we look at what do people need and how do we meet them where they are, that's the criticality of, being a good community partner, is not just doing what feels right to the organization, but doing what is right for the community. And the partnership there was just invaluable.
That's great. And Carlos, did you want to talk a little bit about some of the other non-traditional partners that y'all worked with, or?
So Trinity Health, not Trinity Health of New England, but the greater Trinity Health had an It Starts Here program. And the It Starts Here program was a grant-funded program where we would send grant funds into community-based organizations. And they just had to tell us what they were doing, how they were doing it, and who they were impacting. And so one of the largest things we did was get funding out into the community so that the organizations that the community trusts and participates with and believes in were already out there. What we needed to do is to get them the funding to be able to sustain the efforts that they were undertaking. That was a huge part of our initiative and how we were able to hopefully make a difference.
That's great. Thanks, Carlos. Yeah, and I think one of the real gifts in working with Trinity in this work was, as evidenced by Carlos's remarks, was their ability to share power, I guess would be the right word, with the community organizations and let them lead, even though, again, when we kind of think about a pandemic as a health crisis or issue, you would think there would be strong opinions from the hospital. And I think the graciousness in which all of our partners acted in Trinity, absolutely an excellent example of this in terms of turning to the community and offering them, not offering them, but actually, having them lead was huge. So thanks for that, Carlos.
I appreciate that acknowledgement, but I think we are now in our third cycle of grants, and not just related to COVID, but related to other community-based organization granting around what's really important to make the community better. So this isn't, just specific to COVID. It is also around what else do we need to be doing to help make our communities better. And as we do the community health needs assessment, in this year, and we do our implementation plan, we are also spending several $100,000 this year in looking at what we can do in all of the communities that we're located to help community-based organizations have a further reach and do even more, because that is essential to our mission, and that's why we exist.
Great. And I think it's also a really good example of the type of systems change we need to see to really invest in kind of equitable well-being. So that's great. Laurence, did you want to chime in on this question?
Definitely. So about partners, I have to say, we kind of formulated a strategy that focused on both traditional and non-traditional partners, because we saw that we had a capacity issue. For a town in a public health system, we have pretty limited staff and resources in place. And so very early on, when we saw the vaccine rolling out, we started reaching out to various partners. And for example, one that I would say is kind of a non-traditional partner, at least for us, is our fire department and paramedics. we had more than 30 of our paramedics sign up to be vaccinators, and they became regular vaccinators throughout our town services, which was just outstanding because that provided recognition. Honestly, as individuals came to our clinics, some of them would say, oh my gosh, you have fire department paramedics here, they would want to talk to them, and they might know them because of providing house calls for certain maybe members of their family. When it came to our children and the need to provide outreach and accessible vaccination services, we teamed up with InterCommunity, who is our school-based health centers here for East Hartford, and conducted several drive-through clinics at schools, as well as walk-up clinics within the schools. And that included during weekends and after hours. And for us, knowing that we have high social vulnerability index needs, which includes lack of transportation or challenging hours for individuals to access care, it was very critical for us to be able to work with our school system and within our community to have resources to conduct clinics on weekends and evening hours to provide access to our families for vaccination. And then when we talk about partners within our community, with the resources that we developed with United Way and Latino Way, we linked up with several of our organizations that, again, provided us with credibility and recognition with our residents. So like I mentioned, we had several pop-up clinics at our churches that were primarily Black and Brown congregation members, like St. Isaac Jogues Church and Rose Catholic Church. We teamed up with our soup kitchens, and I just got to share real quick that one of the coordinators of our soup kitchen was probably one of the strongest advocates when it came to building trust with individuals. We went to a clinic thinking that we might only have a handful of individuals that would get vaccinated, and there was one clinic where we vaccinated almost every person that came in to receive meals at the soup kitchen. And mainly it was because the coordinator would just stop people on the spot and say, are you vaccinated yet? Why not? Let me answer your questions. I got it. Let's talk about why you're going to get in this next line and get vaccinated right here on the spot because we brought them here for you. I mean, that was just amazing to have those partnerships to do that. And those are partnerships I know that we can build upon, and we're already talking to several of these groups to work with us on other health initiatives that we know we need to address here for East Hartford. And I'll just kind of close on a point that with these partnerships that we have going on, and for example, with our paramedics, we did homebound vaccinations for medically homebound individuals, where we vaccinated just a little under 100 individuals in their homes by teaming up with public health nurses and paramedics. And not just providing vaccination, but we are starting to look at other services we can provide in individuals' homes, such as smoke alarm and carbon monoxide detection, fall hazard assessments, and so forth. But coming back to the vaccination part, with having these types of linkages with our community partners and organizations on providing capacity, we went from a town that back in early April and May, we were in the lower 30% of coverage for our residents. And now as of today, we're in the top half of coverage, above the state average. We've addressed disparity gaps among specific groups of our populations, and we're performing just as well or better in several age demographics with compared to the state as a whole. And it's because of that capacity and that partnership that we had as our model going from the very beginning.
Thanks, Laurence. That's great. And I love the stories of all the partnerships, and I think one of the not secret powers, but one of the great things that we found even in Hartford as well, working with the health department, was the willingness to share data with the non-clinical partners, the community partners. And, it was kind of amazing to see that conversation happen, because I think, here's where we find shared purpose, right? So we're talking to the soup kitchens or churches or, social service agencies, and all these places really truly care about the folks that they serve. And so to talk them through, what the data is showing in terms of keeping, protecting people from COVID and what we can do, and then really thinking about that and then coming up with ideas around how to do that and then really doing it, I think was such a gift. So Laurence was a great numbers guy and has been a great numbers guy, because it really helped us, I think, get, community partners excited about the work, and then also to see that change, right? Because that's the other really awesome thing about data, is you can watch it improve over time. So I love that story. Rashad, do you want to chime in?
Yeah, I think that's actually a really good segue, Gina. Thank you for setting the table for that. In addition to new partnerships, certainly as we outlined in talking about our partnership with Trinity and how we were able to truly expand and provide services to so many, was also being able to enhance some partnerships that we had previously had before. So for example, to Gina's point of data and working with the health department, we've always had a very collaborative relationship with the health department in Hartford, but certainly that has just grown tremendously since throughout the pandemic. And so, for example, with our testing operations, we, in addition to Trinity, partnered with InterCommunity, with Wheeler Clinic, to go out and create a Hartford Public School testing initiative where we would look at the data and see where are some of the areas of highest need and identify neighborhood schools and set up testing events at the schools. As vaccines became available, we continued to work with the health department to identify those neighborhoods again in terms of vaccination, and went in and vaccinated at those schools and held those events at times that were most convenient for people to come and get vaccinated, either during the school day or after school, weekends, such and so forth. So, that was certainly something that was very important for us to recognize, that there's not a straightforward way to do this work when we're looking at having such a positive impact on so many people. And in addition to that, during the public health emergency, being able to provide these services in areas where typically, because of our strict regulations, we were not able to do so before, having to work with the Department of Public Health to figure out, okay, how can we go over to this church and vaccinate there, where as a licensed medical, federally qualified health center, those aren't the types of allowances we had pre-pandemic, right? So being able to take those partnerships a step further to say, this is what the community is going to need, the community needs are, how can we bend this and modify this to make sure that we're able to meet the need, and continuing to push that throughout the pandemic, because it wasn't just as seamless as asking for it. There was a lot of red tape that we had to continue to push through. And as we keep talking about systems, and while we've been able to demonstrate that there are allowances when the situation calls for it, or when the needs call for it, how do we then take that to the next level to implement true sustainable change?
Thanks, Rashad. That's great. Yeah, that last piece, I think, that really it leads into kind of the last question about systems. But I think, the pandemic, one of the things it really tested was like, why do certain things have to be this way? And when we think about, kind of improving equity and dismantling racist systems, I think that's the question we keep have to ask, right? We keep have to asking, like, does it have to be this way? And often the answer is no, right? We just have to kind of figure out the best way to do it that serves folks. So with that, I'll open up the last question about systems, and this is my favorite question. But what have we learned about systems that perpetuate inequity? And are there obvious ways that we can work to dismantle them? And I'll start with Carlos, if you want to start that one.
Yes, happy to do that. One of the things that I think we have to do is introduce the voice of the people who don't often get heard. So one of the things we try to do more and more is to ensure that the community members and that the community leaders are individuals involved in the dialogue around what do we need to change, how do we need to change it, and what resources do we need to bring to bear for that to happen. And for us, the real key is making sure that the voices at the table can be heard. Because if you don't include the right voices, then you might as well just stop the conversation. The dialogue is not important if you don't include the right people.
That's perfect. Thank you. And Laurence?
So I kind of have two quick thoughts on this, maybe one that's kind of more immediate and then kind of a long-term ambition. One is that from the public health perspective, it's important for us to be involved in local jurisdictional planning of our programs that address the socioeconomic issues that may impact some of our inequities and social determinants of health that lead to disparities. And so that's making sure that we are a voice when we're talking about workforce development initiatives to address higher unemployment, social engagement with programs that foster health and well-being, like parks and rec programs, law enforcement, our libraries, and so forth. And so I think we have an opportunity from this pandemic that there's kind of a spotlight on where is public health now, what are some of the issues that we've seen in our response and some of the gaps, but then also how they might kind of play into a broader picture of addressing some of these disparities and issues of quality of life that have just been exacerbated by the pandemic. So that's one thought. The other one is that I feel like we need to.
Laurence,
Yes, sir.
Can I ask you a question?
Yeah, go ahead.
One of the things that Trinity is trying to do is, language is important. So one of the things we're trying to restate is social determinants versus social influencers, because we believe they may influence, but they don't have to determine. Yep. And the only way they have to determine is if all of the systems allow them to. So we're beginning to call our social influencers of health just that, influencers, because we believe that with the right amount of effort in all the right places, they may be an influence, but they don't have to be a determinant. So I would beg my colleagues and our industry to begin to think a little bit differently about how we characterize what would be considered determinants in other circumstances and consider them, instead of determinants, influencers, because they do influence, but they don't have to determine.
I agree. Actually, I'm going to have to try to remember to phrase that more towards social influencers. I think it's a great distinction and a great point. And then just one last quick point is that I think for us, public health, we need to really understand that we need to assemble a more diverse public health workforce that it involves individuals at the local level that represent the communities that we serve. I feel like some communities have not done a very good job in trying to train the next generation workforce to recognize the importance of public service and especially in public health. And that's something that we've been discussing here at the local level of working with our school programs, our Connects program through Town Hall to try to mentor and bring on volunteers and interns at the high school level to make sure that they are exposed and understand the benefits that public service can have within public health and try to get them engaged early on so they can really kind of consider this as a career track and hopefully maybe come back and serve within the community that they live or grew up in.
Laurence, that's great. Yeah, I so hope that some of the investments being made by federal government and others are really gonna, like you say, bring public health back into that kind of community vibrancy conversation, because it's I think such a tremendous opportunity. That's great. And Rashad, I'd love to give you the floor for some last words.
Yeah, thank you. So I would say, just to Laurence's point, I certainly, I think there's a continued charge for more diversity in the workforce, throughout all industries, but as we specifically think about it in the public health sector, not only just, on the front line, but also at the leadership and executive levels as well. So when we talk about providing that, those opportunities and ensuring that representatives of the community are at the table when it comes to, making decisions that are going to ultimately impact the community as a whole. So that would be one. Another is as we continue to think about the root causes of systems, it's first acknowledging the reality that this does exist and has existed for some time. I mean, I think certainly George Floyd's murder was very polarizing, and there's it certainly pushed a lot of conversation and a spotlight on these issues, but these issues have been around for an extremely long time. So, as Gina mentioned earlier, that, things don't necessarily have to be this way. It's important for us to be transparent about the fact that they have been this way. So if we're going to continue to do the same things and expect a different outcome, then the onus is on us. So we have to truly think of and be intentional about, looking, before we launch into doing what we're used to doing, because that's what's comfortable for us. We need to pivot into having those tough, necessary conversations and going through the experiences that come along with that in order to truly be the change that we want to see. And that's not easy work to do. It's not something that can just be done, quick, fast, and in a hurry. It's certainly something that is a continuum. But we have to first educate, and then we have to continue to put the energy towards truly looking at not only just the system, but how we can continue to work together to move in a different way than we have in the past.
That's perfect. I love that ending. I love thinking about really what I would call the brave work of all your organizations, and then to you, Rashad, Laurence, and Carlos, in terms of this work, but really the kind of foresight of thinking it forward around changing the language, changing the systems, inviting in the next generation. I think, these are all things that are the absolute ways we have to work to dismantle systematic racism and really bring about some equitable change. And I want to thank you personally and thank everybody personally, and turn it over to Venton for some closing remarks.
Thank you, Gina. I also want to add my thanks to Laurence, Carlos, and Rashad for participating in today's panel discussion. And thank you, Gina, for moderating our discussion today. But I really am enlightened. I've been enlightened by our discussion. But I have to tell you the truth, as a man of color, a Black man, this topic of health, racial inequality really produced some mixed emotions for me personally and professionally. It brings to mind what Dr. Martin Luther King said, that we live in two Americas, or the other America. In one America, people have who has the means receive excellent healthcare treatment for various forms of sicknesses and diseases. And in the other America, people like my father receive inferior health treatment because of his color, of his skin, or the zip code where he lives, or in his inability to pay for care. You see, I remember having a discussion with my father's primary care physician. My father had prostate cancer and various other chronic health issues. And the first time I met my father's primary care physician, I questioned him because of my involvement with the healthcare system, why my father wasn't receiving the recommended care that was subscribed based on his age and his ethnicity. And he looked me straight in the face and told me that he didn't know that my father had other family in the area that will be able to assist him or provide financial assistance for the care that he needed. And that just blew my mind, that someone that was treating my dad for many years never took the time to talk to him and understand who his family was and understand his personal need based on his makeup. But today I'm also hopeful, you see, because I'm hopeful today because of the work that United Way is doing around racial equity initiative, the work that my colleagues and I are doing at InterCommunity with the help of the United Way and other community partners such as Trinity Health and Charter Oak and the town of East Hartford. You see, at InterCommunity, we truly believe that we can make America one nation, indivisible, with liberty and justice for all. Unlike my father's doctor, we at InterCommunity place more value on our clients' health outcome than our profit margins. We are committed to treating everyone, no matter their ability to pay. We collect data on race, ethnicity, and language so that we can better understand the patient that we are treating and provide the highest quality of care for their whole person. I know because of the work that we're doing today collectively, my 3 sons' life expectancy will not be shortened simply because of the color of their skin or their zip code. So I just want to thank you again, and I remind you of what I said earlier in our program. I referenced advancing equity outcomes for children and families has always been our core at the value of the United Way through continued emphasis on racial equality and inclusion in engaging volunteers, funding our community-based programs, and collaborating with others. United Way is committed to achieving more equitable outcomes for communities of color. There are a variety of ways that you can support us and get engaged in this important work. United Way is dedicated to securing diverse representation from our community on committee, volunteers, and committee provide leadership, direction, and guidance in the organization's work and operation. If you're interested in volunteering on a committee, please contact Kim Reeves, United Way Director of Leadership and Major Gifts Given at Kim Reeves, and it should be on the site for you. To do this work requires financial resources. If you have not yet made a donation to our 2021-2022 campaign, please consider making a donation today to the United Way on the United Way website. You can make an unrestricted gift, which will be invested in ways that both advance equitable outcomes while meeting the greatest need in our community. You can also designate your gift to the United Way for Racial Equity Initiative, which was referenced earlier in our program. When making a donation, I ask you to please consider making a gift of a leadership level of $1,000 or more. If you have already donated, thank you for your donation. And I respectfully ask you to consider making another donation. You can also support United Way's work focused on racial equity by joining us on our May 23rd at our 2nd annual Live United Golf Tournament at Shuttle Meadows Country Club in Kensington. The proceeds from this event will be invested in United Way's United for Racial Equity initiative. Sponsorships are as well as golf opportunities are available. Visit United Way's website for more information. And again, I just want to thank everyone who participated in our panel discussion today. Thank you, Laurence, Carlos, and Rashad, and Gina, once again, for your participation as our moderator for this discussion. A special thank you is extended to all of you who are here today listening to our discussion and those who are participated. Thank you for our guests and have a great afternoon. This concludes today's Leadership Town Hall. Have a great day.